Thank you, Cheryl and Vincent and all the members of the Equity Advisory Committee. And now, as I'm speaking, I will invite the members of our next panel to please come to the stage to introduce our next panel, which is titled Building an Equitable System for All, Insights from State Leaders. You know this is a plan that will not sit on the shelf. It is also a whole of government, whole of society dialogue that encourages the engagement of local, state, and private partners to drive system change. We are proud today to have so many outstanding state leaders represented on panels. This panel will look at topics including housing, transportation, and healthcare. And I am pleased, look how fast they moved. I am pleased to introduce the members of our first state panel as follows. We have, and you can raise your hand, it's not well, I can go in order. We'll start with our moderator. To my far right, we have the Director of the Department of Rehabilitation, Joe Xavier. Welcome, Director Xavier. Next to Director Xavier, we have the Secretary of our Business, Consumer Services, and Housing Agency, Tomika Moss. Welcome, Secretary Moss. Thank you for being here. To her left is Michelle Boss, the Director of the California Department of Healthcare Services. And here at the far left of the stage, we have the Undersecretary of the California State Transportation Agency, CalSTA, Mark Tollefson. Welcome. The program is all yours, Director Xavier.
Well, first of all, thank you very much, Susan. Hello to everybody. Wonderful house and everybody online. Welcome. Glad to have everybody participating. So this morning's speakers gave us a lot of information, a lot to think about. And a couple of things that I jotted from their comments was dare to imagine. And I think dare to imagine really frames what you're going to hear from this panel today. If you've lived it, you can feel it. And if you can feel it, you will understand it. I think it's fair to say that you will feel aging, and you'll likely age into disability, which means you'll understand it. A whole lot better to start understanding it now than then, I assure you. As a person who was blind, I know firsthand what it is to live with a disability and what are the supports that I need to be able to do so. And watching my 93-year-old mother, what she is living with, how she's aged into her limitations, these are all things that we will all learn and live with, and understanding them and how we can navigate them is invaluable. Both of us have the need for housing, for health, and for transportation. The only question is, how do we each approach those, right? So today, you're going to hear from our panel how housing, how transportation, how health is intersected, and how we at the state level are beginning to think and working to further intersect these and make it very more seamless, or much more seamless, for the populations that we are serving. So you've met our panel, so I'm going to start right into our first question. And so Secretary Moss, you have a wide range of experience that includes nonprofit and public sector. You've dealt with homeless and housing. You've dealt with public policy, civil rights, and community development. And you are widely known for a dynamic visionary, bringing people together to tackle the tough issues. Certainly just heard from our Impact Advisory Committee, the key priorities around housing and preventing adult homelessness for our older population. We know that we've seen a 120% increase in adult homelessness for population over 55. So we would love to hear about your career trajectory, where you began, what inspires you, how do you come to where you are, and then regarding the Master Plan on Aging, can you tell us about the important work you are leading with the Council on Homelessness, and then the federal All Inside initiative? So, Secretary, to you.
Thank you so much, Joe. Good afternoon, everyone. I said good afternoon. I'm so excited to be with you all today. It's so incredible to gather around this important work. And as I thought about the very first question, Joe, this issue is very, very personal to me. I grew up in the Midwest. Do we have any Midwestern Ohioans in the room? Okay, I see a few of you. And I was raised by my grandparents. And my grandmother, my mom's mom, raised me and my siblings, my sisters. And it was the first time when I started to really understand what it was like as a child to be raised by an older adult. And all of the complexities that came with having a grandmother as a parent when all of my peers had younger parents, and all of the challenges that life brings as you age, and seeing those things firsthand as a young person, and understanding that even then my grandmother was a person who taught me what it was like to be in service of others. She never made us worry about her plight, her aging situation. My grandfather died in 1994. She then raised the rest of our siblings, right? She didn't complain. She did it for her family, and she showed us that that's exactly what she expected us to do. So I feel like my career was really defined by that very principle of service. And I've spent the last 21 years here in the state of California trying to figure out how do we create opportunity and access for all. And as I think about why it's so important to do this work for our elders, not only do we know that the growing population of those experiencing homelessness in our communities are over the age of 50, I think someone said it earlier, that we have to redefine how we take care of our elders. We have to reimagine what it means to have a system of care, to have infrastructure and support and community to rely on as we age. And so I'm really excited about some of the work that our agency is doing in service of that. I am one of the co-chairs of our California Interagency Council on Homelessness. And my fellow co-chair is Secretary Johnson from Human Services. And what's exciting about that body is that it represents an all-government approach. I think Susan said this. Every recommendation that we've heard from the committee so far is going to take everyone in our community to make sure that we realize and implement the vision of this plan. It is not only the state's responsibility, is not our community-based organizations, it's all of us. And what's exciting to me about the Interagency Council on Homelessness is that we have representation from 5 agencies and 13 departments on that body that is really designed to figure out how do we advance solutions to end and prevent homelessness in the state of California. And you know, and several of my colleagues in the room, Joe is on the council with us, Susan sits on the council. But what's exciting to me about where we are in our plan development, we are coming up right now with an action plan. We're updating our current action plan to prevent and end homelessness in the state of California. And this time, we really want to focus on outcomes. We know that this administration has provided more resources toward our housing and homelessness crisis than any administration in our history. And we know we need to do more, but we also know that we need to make sure that the resources and strategies that are happening in communities are delivering on the results that our community expects and deserves. And so this next version of the action plan is really going to focus on numeric goals. How do we make sure that we are reducing the number of people who fall into homelessness in the first place? Prevention is such a key strategy to addressing our homelessness crisis. And I'll just share, there are communities all across the state who are doing incredible work to disrupt our housing and homelessness crisis. And I often get asked, Tamika, do you know what to do? And I'm like, yes. We actually do, and we need to do more of it. We need to scale it, but we know what to do. But the challenge we have is, for every person that we house, 3 to 4 people become unhoused during the same period of time. So unless we are looking at our prevention strategies and making sure that we are meeting people where they are before they fall into the housing crisis, we're really not going to be able to address the crisis at scale. And so these are some of the components of our work within the action plan that we're currently developing as the council. And what's also really exciting is that the Interagency Council on Homelessness, our Cal ICH team, is leading our statewide policy on how to help our local jurisdictions actually implement the work on the ground. So we are collecting data from our 44 continuums of care in our statewide data system that allows us to now understand how many folks are we housing, how many folks are exiting to permanent housing, how many folks are staying housed. And collectively, over the last year, we have housed more than 73,000 people across the state of California. That's significant, y'all. I mean, give yourselves a hand. Many of those are our elders and our seniors. And so it's really important that we now have benchmarks to be able to build from as we set some of these numeric metrics. So I just wanted to highlight some of the work of our council that I think will be a really important component of the implementation for the master plan. Another area, and Joe, you kind of asked about this. This is a long-winded answer, y'all. So just hang with me. I got lots of talking points, but I'm gonna make it engaging nonetheless. I think the speakers before us was talking about why equity is so important. We have an incredible lived experience advisory board that informs the work of our Interagency Council on Homelessness. And I know that that is one of the goals for this plan. It is so valuable to not just listen to folks with lived experience in the way that we do policy and planning, but to actually implement what they say. And so it's really, really thrilling to me that we can provide some guidance for the Master Plan on Aging on how to set up that advisory board, how to make sure that we are integrating those voices into our strategies and making sure that those voices are heard. So just wanted to highlight that. Another piece that I think is important as we do our work both across all of the sort of intersectional policy areas is to recognize that these challenges do not happen the same for everyone. Someone said that the reason there's such a surge in older adults experiencing homelessness certainly has to do with the lack of supply of accessible, affordable housing. But it also has to do with our structural racist housing policies that have permeated our infrastructure and systems for decades. And we are still living under those realities. So we have to be crystal clear that those realities still exist. When you have disproportionate impacts for Black and brown folks across the state who are experiencing our housing and homelessness crisis, if we're going to remediate or disrupt those persistent impacts, we have to recognize that they are there on purpose. And that in order to sort of repair the harm, we have to really impart that equity lens into the work that we're doing. So I'm super excited to work with the committees on our equity agenda, and that's very much something that we're doing in the agency. And then maybe before I turn it over to Michelle, I'll talk a little bit about the work that we've been doing with the All Inside initiative. This is the initiative with the White House Domestic Policy Council and the United States Interagency Council on Homelessness. And we've been working, California was selected as one of the partners, the entire state of California, as one of the partners in that initiative, Joe. And what's been exciting is we've been really exploring how do we expand some of the waivers that will extend the term of time-limited federal rental assistance that we need to help our elders and seniors connect to housing, right? What are some of the other barriers that we can remove at the federal level to allow some of our policies here at the state level to go further? So I'm really excited about the work we've been able to do. I was just at our leadership summit with Cal Vet. So we're doing a lot of work with Cal Vet in our Home Key Plus program, which is our Proposition 1 resources that will allow $2 billion to go into our communities to build deeply affordable housing and permanent supportive housing for folks with disabilities and our veterans. So we have a lot of things in the hopper, y'all. I'm going to turn it over to Michelle, but I just want to say, it is critical that we not just list off all the great things that we are trying to do, but that we lock arms, we hold ourselves accountable, and we sustain our commitment through implementation, because that's what this work deserves, and I'm really excited to be a partner with all of you.
So, Michelle, we'll come back to you in a second. I wanted to go to Mark. You're the Undersecretary for our Transportation Agency. You oversee a lot of the work that is being done on transportation with the many, many different types of infrastructure and initiatives. And we certainly have heard about how important transportation is to both the disabled and the aging community. Later this afternoon, we're going to hear from our Community Living Advisory Committee, and transportation is going to be one of their key recommendations. So when we were talking about this panel, I shared with you that for me, transportation is about, can I get where I want, when I want, and hopefully on time, or at least reasonably close. So could we hear from you about your career trajectory, how you got here, what inspires you, and the work that you're doing around the Master Plan on Aging? How can California meet the need for that affordable and accessible and readily usable transportation system? What is taking place both at the state level and at the local level on that front?
Well, great. Yeah, really appreciate it, and thanks, Director. Really appreciate the opportunity to be here today. You know, just if we talk about a little bit about my career path, it's been fairly interesting. You know, I started actually, and I appreciate the fact that I get to follow Secretary Moss, because I started my career actually running housing programs for small cities and counties, and really seeing kind of the importance there, making sure people have a safe place to live, and then also thinking about how the transportation system connects people to their daily destinations. I spent a long time after that, you know, with state government. I worked for our Department of Finance for about, you know, close to 12 years. Had the opportunity more recently to actually work under the Newsom administration, dealing with housing, homelessness, and transportation issues. So really appreciate just the strong nexus that exists there for all Californians. And then that led me to now be the Undersecretary at the California State Transportation Agency. And if I think about transportation and the importance to the aging community as well as folks with disability, I do think back to my grandmother. When she was kind of getting older, and she lived in Oakland, had a home with probably 24 stairs that she had to navigate, you know, every day to get to her front door. We ended up, as she aged, you know, moved her here to Sacramento, close by, just in a kind of suburban, you know, type neighborhood, which was great for her, so long as she was able to drive her car. At the point at which she was no longer able to do so, unfortunately, we saw, you know, really kind of a big deterioration in terms of her happiness, just that ability to be independent and to go to those, you know, destinations that she was used to going to, you know, going to her church group, going to her daily, you know, trip to the dollar store, the grocery store, wherever she needed to go. And she really, you know, even though we had a lot of family in the neighborhood, she, in a way, felt like she was a burden, you know, asking us to take her to all those locations. Had she had really convenient transit options for her, I think she would have had so much more happiness in terms of moving forward and being able to, again, get to where she wanted to be. So that's just something that I always think about in the back of my mind as we think about, you know, our kind of older adults and folks with disabilities, and just how impactful it is to have that level of independence to be able to get to where you need to be. But getting back to just kind of the work that we do at CalSTA, so we are the transportation agency that oversees all of our transportation-related departments. So that would cover Caltrans, the Department of Motor Vehicles, High-Speed Rail, the California Highway Patrol, and other transportation-related departments. So I've focused mostly, as Director Xavier mentioned, on the infrastructure side, but I did want to talk about some of the service aspect as well. You know, I do think that for transportation, we are probably one of the more public-facing agencies, and that comes with a great responsibility because everyone uses our systems to get from point A to point B. So as we think about just on the service side, everyone needing to interact with the DMV for your ID cards or a driver's license, we recently, actually just last week on October 1st, did make some changes that really are impactful, I think, for older adults, just rethinking the way that we've historically done things. So we actually are now waiving the requirement for those 70 and older when they go to renew their driver's license to have to take that knowledge test. So really rethinking the way, some of these historic things that we've done, is that still necessary, today? So really excited about that change. On the infrastructure front, we are at a really pivotal time in transportation. And the way that, we've really been thinking about transportation now, it historically had been, just how do we move cars, faster, throughout our communities, again, to point A to point B. That's great, but it really is the movement of people, not necessarily the movement of cars. How do we get all users that kind of safe, convenient mode to get to where they need to be? So we've instituted a lot of great programs. A lot of this thanks to the Biden-Harris administration with respect to the IIJA, the Infrastructure Investment and Jobs Act. We have about $41.9 billion coming to California over the next 5 years to really improve our infrastructure. So how do we actually take that and be more intentional with it? And that's something that I think is really key. And what we're really trying to push through as a transportation agency is this cultural change. There's been a way that we've been doing things for decades, right? We've been really focused on highways, but really it is focusing on all modes of transportation and how do we really drive that work? And how does that then translate into older adults and folks with disabilities? That's where we've instituted some great work, starting up an Equity Advisory Committee that's a joint effort between Caltrans, CalSTA, and our Transportation Commission, really trying to hear from folks, how can we be more equitable? How can we be more inclusive with our transportation system? What are those drivers that we need to really get towards? And I know we'll be hearing from our DACLAC, later this afternoon, but really want to, kind of stress that partnership. We do want to hear from you all in terms of how our system can better serve all Californians. So as we think about, some of the work, specifically with transit, I've had the honor of hosting and actually leading our Transit Transformation Task Force. This was born out of SB 125, where we were able to provide historic funding to our transit agencies, $5.1 billion over the next several years, to really think about infrastructure investment, as well as how do we sustain operations. Coming out of the pandemic, obviously a lot of changes with respect to telework, changes to how people utilize our transit systems. How do we make that not only more convenient, how do we grow ridership, how do we make it more safe, more sustainable? Those are all things that we're really focused on through that effort. And some of the topics that we will be getting into over the next several meetings that we have, we're meeting every 2 months as we build towards a report next October, but really thinking about things like paratransit, thinking about not only our transit system, you can get on a bus, with a disability, you can get on a train with a disability, but also thinking through, what about those first and last mile connections? Can you actually get to the bus stop safely, conveniently? So it's, not only that ride of getting you from point A to point B, but how do you get from your originating destination to that transit option and then to your final destination. So those are things that we're really focused on. And again, want to just make a plug, we'd love to get broader participation in those efforts. We have our 6th convening that's actually going to be in Monterey County. So really excited about that. We also have a virtual option for folks, but our next meeting will be October 28th. So would love to see a number of you all, participate and provide feedback as we go through that process and we start driving towards recommendations. A couple other things that I did want to highlight for the group, just in terms of broader, infrastructure. We have made a big effort to really think about what we call complete streets. How do we take our system and really focus on not only vehicular traffic, but how do we get people of all modes moving along our roadways? So that's really focusing on pedestrian infrastructure, sidewalks, as well as bicycle facilities as well. So that's something that's really been a key change for us. So our Caltrans director put forth a policy in 2021 that really said, for every project that we're focused on, it has to be an exception. You have to document an exception for not putting in, basically that infrastructure, sidewalks, et cetera, associated with any of our highway or roadway projects. So that's something that's been a very key change for us and really important as we think about how we serve, again, all Californians. And I want to just note a couple things, as we, approach, the goal of Vision Zero, zero fatalities on our systems. We have made a lot of strides, in that space. We think about, our core four principles at CALSA: safety, equity, climate action, and economic prosperity. Safety is a key focus, for us, and a key focus for older adults as well as folks with disabilities. We've seen actually 9 straight quarters of declines in terms of fatalities across the United States. One of the challenges, though, with that is that California is one of 18 states that have actually seen slight increases. So California, and through the first 2 quarters of this year, 1,900 fatalities on our transportation system. That is way too many. While we, only saw like a 0.3% increase, how do we really drive at that? How do we make our system safer? This also really kind of ties in with the work that Secretary Moss is doing. How do we get people, to kind of live closer to their daily destinations? How can we get people to really focus on, being able to utilize our transit system, really have the ability to utilize other modes? How do we get people, to be able to walk safely to their destination? So just a lot of work that we're focused on that is that change from thinking about only vehicular traffic to other modes. So really, one of the things that I want to kind of close with, and sorry I'm being a little long-winded here, but really want to just focus on encouraging you all to engage with us and encouraging you all to help us with this change, because again, we are at this pivotal moment in transportation where we have more funding than we've ever had before, but really need to kind of drive towards different outcomes as we think about our highway system and our roadway systems.
So thank you. Michelle, let's come to you. So you have a career that has spanned over 20 years in public service. In each of your roles, largely in a position of influencing public policy. You've addressed and confronted many challenges that have been facing the public, facing vulnerable populations. Well, we can think of things like a simple thing like COVID, Medi-Cal expansion, behavioral health transformation, just to name a few. The Impact Advisory Committee also spoke about a home care health system for all and financing solution for LTSS, for long-term services and supports. So can we hear from you about your career trajectory, where you began, how you get to where you are, what inspires you? And then regarding the master plan, what are your reflections for how we can best meet the needs of an aging population, expanding access to services in the community, your thoughts on how we expand services in the community, as well as solutions for the LTSS crisis, the funding of the services. So we'll give it to you.
Great, thank you so much. And really, it's a great opportunity to be here today. The morning session from so many inspiring leaders and the community voices really kind of drove home really why I'm here and kind of the inspiration for continuing to work in this field. So really appreciate the conversations and, know many of you from kind of 21 years or so in state service, and really you are inspiring and you really do drive us to continue to do better. I really appreciate this panel. Just, generally speaking, I work in the health and human services kind of role, connecting those dots together, but being up here with transportation and housing, really this opportunity to go beyond HHS, to go beyond kind of the normal way we connect our dots and integrate our programs, because there's huge opportunities, huge ways where we can all contribute to kind of the well-being and health of California. And so just wanted to start by saying thank you for today. So I started my career, I've been in state service for about 21 years. Started with the state at the legislative analyst office, and got a job right out of grad school. and started in environmental protection, but wanted to get into the health assignment. And after about 2 years, a role opened up in public health, and that really started my path here in kind of the healthcare field. I will note, though, one of my grad school papers was on Medi-Cal, and to think that I'm sitting here as the director of the Department of Healthcare Services when, 25, 30 years ago, I was writing about just the possibility of Medi-Cal. Hearing Secretary Becerra this morning talk about how we need to continue to push and innovate on how we use our federal Medicaid dollars. Health is no longer just in a doctor's office, a clinic, or a hospital. It now means transitional rent. It means food. It means so many services and supports that were never part of the Medicaid program today. So just there's huge opportunities in this space, and we really do look forward to working together with you. In terms of your question regarding some of the Impact Committee members' recommendations and and the comments today, wanted to talk about 2 efforts we have underway at the department, the home and community-based gap analysis and roadmap, and then our long-term services and supports financing and affordability study. So as you know, the department is working towards integrating managed long-term services and supports into the managed care space. And as a result of that, we've commissioned and are working on an HCBS gap analysis and a multi-year kind of plan for how we want to engage in that effort. The goals of this plan are really to reduce disparities in access, to make these services a statewide benefit, to really increase the ability for any Californian to get those services no matter what county you live in, no matter if there are slots available or not. We want these services to be available to all Medi-Cal members. Really, yes. Also hearing from kind of the conversation this morning about the importance of coordination, navigation, streamlining, and being very clear how individuals can access these services. So that is a core piece of kind of our multi-year plan and how we think about that. Our final gap analysis is expected to be released at the end of this year, so the end of 2024. And based on that report and based on also additional feedback and engagement that we've had with many of you, our multi-year roadmap really is going to focus on, again, how we can expand provider capacity, how we can strengthen partnerships between the state, counties, CBOs, providers, and private sector as well, how we can really think about the key milestones and benchmarks that we want to meet along the way as we really move forward with kind of the development and kind of the implementation of really the full potential of home and community-based services. I will note, I know there's lots of questions with regard to kind of our thinking and our plan for the integration of some of our 1915C waivers into managed long-term services and support, and we really do look forward to these continued discussions as we really work towards making these benefits across the state. With regard to the long-term services and support financing and accountability study, very great to hear this morning about Vice President Harris and kind of a plan in that space as well, so we look forward to learning more. But we've been working with the Department of Aging with some consultants on this, really trying to really think about options for the missing middle. So those on Medicare who also need really assistance with activities of daily living at home, but Medicare does not currently really cover them at home for some of our Medicare members. And so looking at affordable options, really, we recognize that informal caregivers often provide this assistance and this help, but this is challenging. And really, how can we better support our families, our caregivers, our members in terms of the needs to really remain at home and thrive at home? As part of this work, we are really looking at kind of best practices across the state and learning from those. We're doing a deep dive in some of from a kind of a data and modeling perspective. There are over 5 million Californians in Medicare, but not on Medi-Cal, and that have disabilities or needs for in-home care. That represents about 20% of the Medicare population, 50% of Medicare spending, and 67% of ER, hospital, and post-acute spending. So really using this data to make an argument to the federal government, to make an argument on why this is important, to really think about how we can develop a benefit and kind of services in this space.
Thank you.
In terms of just kind of some of the accomplishments since the launch of the Master Plan of Aging in 2021, I think first and foremost really want to celebrate the expansion of Medi-Cal to all undocumented persons that started 8 years ago, and so from children all the way up to older adults eligible for Medi-Cal without regard to immigration status. We've covered now about 1.4 million Medi-Cal members for full scope Medi-Cal as a result. So just a huge opportunity to really think about how we build thriving, healthy communities, and very excited that part of that expansion over the last 8 years. Another key initiative that I think the department is super excited about is really CalAIM. We've talked a little bit about that earlier today, but again, that is really rethinking what health-related social needs are, how we coordinate our care with enhanced care management, how we build out housing deposits, how we build out home modification, medically tailored meals, a diversion from nursing home, how we think about how we address the needs of our members so that they can live in their homes and really thrive in their homes. At the end of 2023, just over 28% of members who received community supports were dual eligibles. So we're tracking this data. We post every quarter updated information with regard to our enhanced care management and community support utilization, really trying to drive that utilization. I think that is a challenge that I offer to all of you that we are undertaking at the department, is to really how do we continue to build out capacity and utilization of those services and benefits. We have one more round of PATH cited, which is the infrastructure dollars that we will be awarding to help build out community-based organizations to become enhanced care managers or community support providers. That application process will be released in the coming months, but really urge you to consider applying for that and really becoming a provider in the Medi-Cal space. Also wanted, excuse me, can you hear me? Oh, got an echo. Sorry about that. Also want to celebrate the elimination of the asset test. Yeah. As a result, 12,000 people have access to Medi-Cal that previously may not have been eligible for Medi-Cal any longer, so very excited about that. In terms of a few initiatives underway, January 1, 2025, the Part A buy-in for Medicare we will be implementing, so that will help over 100,000 Medi-Cal members, primarily older adults, get Medicare Part A, so we're very excited to implement that. Also want to highlight a couple things that really are partnerships with the department, our managed care plans, providers, private foundations, the dementia care and screening. As you know, the state was no longer able to fund that, but we worked with some of our providers and entities to really continue to support that from a foundation perspective. So just recognizing the importance that we have government, but we also have other partners in this space who can participate and really lift up some of this great work. Another example is one of our Medi-Cal managed care plans, Inland Empire Health Plan, which covers Riverside and San Bernardino, is partnering with Riverside County in the development of blue zones in that area. So very excited about that partnership and the contribution of the plan to the community to really think through that and build that out. And then lastly, I think one thing I would just continue to stress about what the importance of the Master Plan on Aging and the work that the department is doing is really the stakeholder engagement and really conversations. I think we are all really putting that effort kind of front of mind and really being purposeful in our engagement with our actual members. About 1.5 years ago, the department created its first ever Medi-Cal Member Advisory Committee, where we are directly meeting with Medi-Cal members, and never really had that opportunity before, but really thinking about all the places where we can listen, get better, and really improve the program.
So each of you deal with systems at the state level, but we know that everything good happens at the local level. And one of my colleagues always describes California as pathologically local, right? And we know that collective impact requires coordination, collaboration, and certainly partnership. So I wonder what your thoughts are on how at the state level we continue to expand on that coordination, collaboration, partnership but also at the local level, how do we maximize those opportunities? And Secretary Moss, I think you're uniquely positioned given your private-public experience there. Maybe start us off?
Yes, well, it's funny, I often say that I was a regionalist before I came to state service. I started an organization called All Home in the Bay Area, which was looking at regional solutions to homelessness and housing. And I would often say, well, people like to talk regionally, but they act locally. And so it's really important that we have the partnerships that both Michelle and Mark were describing in order to facilitate the kind of impact that we really want to see on the ground. The state has a tremendous amount of resource and programs and direction for how local communities can engage around these issues, but having both served in local government, having worked as a social worker in communities all across the Bay Area, it's really important to make sure that we are providing the technical assistance, the resources, and the strategy to support local implementation. And so one of the challenges I think we have, and I talk about this often, is there is a lot of incredible political will, lots of organizing, lots of community advocacy around building more housing in our communities. Housing for everyone, housing for our seniors, housing for folks with disabilities, housing for our unhoused neighbors. But a lot of those decisions are made locally. And if people are saying no to housing when we are trying to address our housing and homelessness crisis, then we have a problem. So it's really important to support our community-based organizations, our local leaders who are trying to address our housing and homelessness crisis, but we also have to hold folks accountable when people are saying no to housing. And so it's really important that, we have a housing accountability unit that was launched within our Department of Housing and Community Development that is really working when we have local jurisdictions who are not fulfilling their obligations to housing law. We are confronting those jurisdictions on those things. And that unit in and of itself has unlocked more than 30,000 units of housing that otherwise would not have been developed if not for our state efforts. And so those are the kinds of partnerships that we really need to make sure that our intention shows up as action on the ground. And when we have challenges with our local partners being able to manifest what communities expect, we certainly want to understand what those barriers are and leverage state, federal, all of the resources we have at our disposal. But I think it's really important that we help everyone recognize that we have to say yes to housing, to interim housing, to permanent housing, to rental assistance, right? And we can't, in one breath, complain about our crisis and the devastation on our streets and then resist housing developments when they're brought to communities. So I think that that's a really important piece. And I also, before I turn it back to you, Joe, I just wanted to say something about the other part of our agency. So I oversee all of our housing and homelessness work, but I also oversee our consumer protections. And we license more than 4 million professionals and businesses across the state of California. And one of the things that I think about when I think of older adults and folks with disabilities are folks who are being scammed out of their hard-earned resources and money. And targeted, frankly. It's really deplorable. And so I'm really proud of the work that our Department of Financial Protection and Innovation has done to really go after and target those bad actors who are not being respectful of our elders and taking advantage of our communities. So it's really important that we look at the totality of the work that we're all doing across the various recommendations of this plan, because people live full, whole lives. And we have to be thinking about how do we make sure we're sort of wrapping our arms around how we want our older adults to thrive in community. And so I'm really proud of some of that work we've been doing.
Michelle or Mark, anything you want to add to this?
Just really one quick comment. I think we couldn't echo or say as strongly how important the local connections are, the local planning. And as part of our work on Proposition 1, or behavioral health transformation, and the 3-year integrated plan for community behavioral health services and support as a result of the Behavioral Health Services Act, we are also requiring our county behavioral health departments to work with their Medi-Cal managed care plans and the local health jurisdictions who also have their own local planning processes, so that those local processes are coordinated and not siloed, and so that they're working cross purposes. And so I think to the point of how important it is, it really happens at the local level, but at the local level, kind of thinking about state policies that ensures alignment of that planning process, I think is really important.
And then I'll just jump in really briefly, and I do think that, yeah, it's really important for the state to kind of set that policy, but a lot of the work does happen at the local level. And I think as we think about the transportation system, and actually if you think about transit, for example, if I'm a user of transit, I don't necessarily care kind of who is providing that service, so long as I can get from point A to point B. You think about like the Bay Area, for example, there's 27 different transit providers in the 9-county Bay Area. How do we get all of those folks to kind of really work together, work with the state, make sure we do have that kind of safe, convenient, reliable ride for an individual? If we think about paratransit, how do we really think about kind of those trips that may span county lines or span outside of a city's jurisdiction, right? And how do we really make sure that those rides and the people are coordinating with each other, so that again it's the kind of easiest experience for the user to get from point A to point B. So that's something that really, we want to focus on, as the state, to kind of help at the local level. The other thing, just really briefly, I know we're kind of getting short on time, but did want to touch a bit on just some of the work in terms of engagement on projects. So traditionally, a lot of the community engagement just happens during the environmental phase. And I think historically, with a lot of our contractors and consultants, it's like, how do we get in quick, get the feedback, and really kind of move through the process so we can get our project done. But I think one of the things that we've been really trying to think about is, how do we engage earlier in the process for these projects? Because a lot of times when we get the feedback, it's a lot of times too late to really make any meaningful changes in our projects. So that's something that really we're trying to kind of rethink the way that we deal with transportation projects. One, and again, sorry, just really briefly, we instituted our Reconnecting Communities Highways to Boulevards program recently. This was a program that really, kind of recognized how our transportation system divided communities and provided a lot of harm, particularly to Black and brown communities throughout the state. So with our grant program, we actually did it a little differently, where applicants wouldn't have to necessarily know what project they were going to implement, but it was more of, okay, here's the concept, here's how we're going to plan for it, and let's work together with the state, work together with local partners, work together with our community advocacy groups to really kind of build what that project looks like in the future. So just really, I think that partnership at the local level, partnership with community, is going to be really important for us to have a successful transportation system.
Thank you all. So on behalf of our disabled community, of our aging community, thank you for your commitment. Thank you for the passion, the coordination, the collaboration, and the continued partnership, because to get to where we want to go, there is a lot of work. But we certainly know a lot of progress has been made, and we just applaud all of you and your teams for what you're doing to move us in that direction. Many years ago, when I started holding a microphone, somebody told me, keep it short when you're standing between people and food. So I'm standing between you and food. Please join me in thanking our panel so we can...
Thank you all. Thank you to all 4 of our panelists and the thousands of employees that you represent that are working very hard on these issues that you shared with us. Thank you very much for joining us today. For anyone who got grief at the office and said, oh, lucky you, you're going to a conference like it's a vacation. It's not. We are going to work you. We have just a brief time for lunch today. We are serving box lunches in the lobby area. You are welcome to bring them back to your seats here to eat in the lobby area. we ask one thing of all of you, that you please return to the office. Return to the ballroom by 1:25. We heard earlier from our Senate President Pro Tem. At lunchtime, we will be hearing from representatives from our state assembly, representatives who were instrumental in protecting programs that benefit older adults, people with disabilities, and family caregivers, housing, transportation, and healthcare in the budget this year. So we want to return by 1:25. And you're free to help yourselves to lunch. And I do want to thank all of the Convention Center staff, the wonderful AV team that's supporting us today, as well as everyone who prepared the meals we're about to enjoy. Thank you. See you back here at 1:25.